Being a parent is a very exciting thing. It is also a very scary thing because now you are responsible for somebody else. They are completely dependent upon you and you don't want to let them down. Well, I'm Dr. David Shannon, dentist. I have a dental practice in Northridge, California, between Tampa and Reseda Boulevard on Nordhoff Street. And I am here to support and help you in dealing with your children when it comes to their dental needs. So the first question, of course, that everybody says is, when should I bring my child in to the dentist? And there are a few different feelings about that. There's a few different answers to that. Different people, if you ask them, different experts will tell you different things. So I want to tell you that if you know everything you need to know about your children's teeth, 3 years old is fine. But unless you're a dentist, how do you know about your children's teeth? You might go and Google children teeth. Well, what information are you getting? What sources are you getting it from? How reliable is Wikipedia on children decay? That's where the question comes in. So, my feeling is, before 3 years of age, we're really educating the parent. So, if you're a parent of a newborn child, you have a lot of questions. When does the first tooth come in? How old is the child when the last baby tooth comes in? What do I do when one tooth comes in? 2, 4 teeth. There's so many questions. So, my feeling is, once the baby is 6 months old, you start the clock. Now, sometimes at 6 months old there is one tooth. That's the average age. But what if your child gets their first tooth at 3 months old? Does that mean there's something wrong with your child? Absolutely not. Some people develop faster than others. What happens if my child doesn't have a tooth at 6 months old? Oh my God, he's not going to be a rocket scientist. No, 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 no. Some just develop a little later. Don't be nervous. Take 6 months, whether they have a tooth or they don't. Take 6 months. Add 6 months to that. 1 year. That's when you should bring your child into the dentist. Now, not a lot is going to be accomplished then, but we're going to be able to explain to you as a parent. You have a 1-year-old. What is it that is expected of you about brushing, about caring for the teeth, about the type of diet that is needed to support these teeth that are developing under the gums but just haven't broken through yet. So, 1-year-old, you're bringing your child in. At that point, there's usually at least one tooth in the mouth, sometimes 2. And as these teeth move and grow in and more teeth from the front and the smile becomes prettier and the top teeth and the bottom teeth and everything is starting to look great, then the parent somehow doesn't realize what's expected of the back teeth and more confusion arises. So we try at 3 years old to look. We should see pretty much all of the teeth in the mouth at 3 years old. Again, if some of them aren't there, it doesn't mean that your child is behind in their development. And if they're all there when they're 2 years old, they don't get a blue ribbon, they're not going to become Einstein or anything. It's just the way things are. So at 3 years old, we are going to count all the teeth, clean all the teeth. We're going to examine all the cracks and the crevices of the teeth and assume that this is the shape of their jaw as they grow and develop. Now try to remember that a child at that age has a small mouth. This isn't where all the permanent teeth are going to be fitting. So between the age of 3 and about 6 years of age, they're going to have 20 teeth in their mouth or all of their baby teeth. At about 6 years of age, and again, it could be 5. I've seen plenty of 5-year-olds that lose a front tooth, and you probably know people yourself, and plenty of 7-year-olds that haven't, that feel they're the only one in kindergarten that hasn't lost a tooth yet. But at about age 6, one of their front teeth are going to be lost. Now, take a look at that baby tooth before it's lost. It's really, really narrow. I mean, it's just tiny. And then that permanent tooth is going to come in. So take a look at your permanent tooth. Take a look at someone else's permanent tooth, especially if they're really big. Suppose somebody's almost 6 feet tall. Take a look at the size of that tooth. Now, try to picture that tooth in that little tiny mouth. It's going to be tough. But that tooth is going to grow in no matter what, if the time is ready for it. So it might come in a little crooked. It might be twisted or turned a little bit. It might be tipped a little bit. But it's going to come into that space no matter how small the space is. And then over time, the jaw is going to grow to accommodate the teeth. So in that period of time, you need to see the dentist, because the dentist is going to be monitoring at that age, at 6 years old, how much space is going to be needed for the mouth. He doesn't have a crystal ball, so he doesn't know how much the mouth is going to grow, but he can get an idea of where things are. And once he knows where things are, he might be able to say, let's not wait 3 or 4 or 5 more years to do braces. He might say, let's put in a special appliance just for moving these couple of teeth around. So there are different options that we have. And we don't want to say, gee, if you only came in and saw us last year, we would have been able to take care of this, but now it's too late. And we don't want to say that we're not able to do this because it's too soon, so we're just going to monitor it, and then it's never monitored because the patient doesn't come back at the appropriate time. So every 6 months when the child comes in for a cleaning, those teeth are always evaluated for orthodontic problems. And the average age to treat orthodontics is usually, again, average, 12 years. Now, I've seen some children in my practice who at 10 years old, we're ready to put some sort of appliance in their mouth. Sometimes it's removable. And that's kind of nice because it's easy. Take it out, brush their teeth, they can eat whatever they want, and that works out great. Sometimes it has to be wires and actually cemented braces because of their particular needs. Every child is different. Every problem is different. You need to go to the dentist and have things monitored so you know exactly what's going on. So, hopefully this gives you a little overview of children's dentistry. Feel free to check our other videos on other areas and other topics at the website. Give us a call at the dental office. We'll be more than happy to schedule an appointment for you for a consultation so that we can let you know exactly what the situation is with your child. Your responsibility does not end with you. It starts with you. It ends with your children. Please, please think of them. Take care of them. I hope this was helpful. Thank you.